right, so the next section is going to be on environmental health and toxicology, and this is chapter 8 in your book. There may be a lot of terminology in here that you don't know. There are a few concepts that do overlap with 212 a little bit if you've already taken that. So environmental health, we'll start by just defining health so that you have an idea what we're talking about. It's defined as a state of complete physical, mental, and social well-being. And joke is we all struggle with some of these. So disease is just an abnormal change in the body's condition that impairs physical or psychological function. So we're all used to this word disease, but sometimes we use this term a little bit loosely. It is also important to note that a lot of things contribute to health and disease, including diet and nutrition, infectious agents, so actual organisms that make us sick, toxic chemicals, genetics, trauma, and psychological stress all play a role in morbidity, which refers to illness, and mortality, which refers to people dying. So, environmental health risks. Environmental health focuses on external factors that cause disease, not internal. So, like, we're not really concerned with genetics or things like that. So, it might include agents or pathogens, which I'll define that in a few minutes, like bacteria or viruses. It could include trauma, so different kinds of accidents. Pollution, including air, water, noise pollution, exposure to toxic chemicals, which we see down here. Note that this says toxins. I'm going to go through and give you a definition of the word toxin. This is actually, this word is being used incorrectly. So we'll go through that in a few minutes. And then it can also include radiation, which could come from either the sun or from things like radioactive material. So mortality from disease has actually decreased. Life expectancy is increasing, which we talked about in the human population chapter, and infant and child mortality is decreasing. So we've done a really good job at dealing with disease overall. In general, healthcare has gotten a whole lot better, and we see this life expectancy increasing over time and child mortality rates declining dramatically in some places, but even in North America, as our healthcare system has improved, and as well as in Europe, we're still seeing lower child mortality rates than we had in the past. So when we talk about all these ideas, we talk about the global disease burden. And the disease burden is the impact of health problem as measured by its financial cost, mortality, morbidity, or other indicators. And we often quantify these in terms of quality-adjusted life years or disability-adjusted life years. So this is basically the number of years lost due to disease. So that could be the number of years lost due to a decrease in life expectancy, or a decrease in the number of quality years. That means years living without some kind of chronic disease or disability that impacts your ability to work, interact with your family, or do things that you enjoy. And we see, if we look at these dailies, disability adjusted life years, we see that it differs by the sex of the person, so male or female. And we see things like dietary risks, smoking, a high body mass index, so being overweight, and high systolic blood pressure as being the things that contribute the most. But how these rank depends on whether you're male or female. So if we look at total disease burden by cause, we see that injuries have stayed a pretty similar percentage over time. This goes from 1990 to 2019. And we see that communicable maternal, neonatal, and nutritional diseases make up a much smaller proportion of the total disease burden. So this includes pathogens, so like viruses and bacteria. This includes problems with newborns, things like that, as well as nutritional diseases. So like having vitamin deficiencies or just simply not getting enough calories. Those things have decreased over time, whereas non-communicable diseases make up a higher proportion of total disease burden. And these are things usually caused by lifestyle factors, but there can be a small component that's genetic in some cases. So if we look at these in more detail, we see that over time, the things that are most important to the global disease burden have changed in rank. So, and this is across the whole, all of the people on Earth, not just Americans. So we see that some things have increased in prevalence and some things have decreased in prevalence. So as we said before, some of these infectious diseases caused by pathogens have decreased. So like respiratory infections, diarrheal diseases, malaria, tuberculosis have all decreased in prevalence, whereas we see some things have increased in prevalence. So in 1990, heart disease was ranked number 4. It's now ranked number 1 worldwide. And we see that stroke has increased in rank, low back pain has increased, major depressive disorder has increased, diabetes has increased, as well as HIV/AIDS. It's one of the few infectious diseases that has increased dramatically in prevalence since 1990. The only one on here in the global disease burden that's just an injury is road injuries. So that's things like car accidents. And that's actually increased in prevalence since 1990. All right, so if we look at that just by percentage, and this is the 2019 data, we see that the number one cause, and this takes out, no, this is the total disease burden, sorry. The number one is cardiovascular diseases. Number 2 is cancers. Then we have neonatal disorders, respiratory infections, and tuberculosis combined. So you can see that these different figures are lumping things together slightly differently, and so that does change some of this. And then you can see some other things listed that are clearly important, but you can really see what the top 4 are pretty clearly up here. So global disease burden, we see that chronic conditions account for premature death and disease in both developed and developing countries. And these chronic conditions are what we see increasing in prevalence worldwide and in the United States as well. So heart disease is the leading source of disability and disease worldwide right now. And global cancer rates have also increased substantially. We also see that diabetes is on the increase. 1/3 of children born in North America today will develop diabetes in their lifetime. We also see tobacco-related lung diseases are increasing. And it's really important to note that a lot of times people think of these things as being genetic, but these are all really lifestyle-related diseases. A lot of these things can have a small genetic component, but most people can, even if they have some of the genes that relate to higher prevalence of some of these, can alter the severity or how much they have to live with these chronic diseases by changing lifestyle. So the most important factors are how much people consume fruits, vegetables, and whole grains, how much people move around. So I didn't put exercise because we're finding more and more that everyday movement is also really important, that if you get your 30 minutes to an hour of exercise in and then you sit down all day, that doesn't necessarily make up, the exercise doesn't always make up for sitting down all day. So how much you move around is important. I say this as I'm sitting in my chair giving you a lecture. Stress is really important, and we've seen that skyrocket in the United States. Sleep, getting 7 to 8 hours of sleep a night really can affect the prevalence of some of these. That's when your body repairs itself. If you're not getting that, then it may not be able to do that as well. How much alcohol and tobacco you consume as well. Alcohol does increase the prevalence of many cancers and some other chronic diseases as well.